In this video, we will discuss hepatic encephalopathy. In hepatic encephalopathy, most of the issues deal with the brain and its dysfunction accordingly. However, this dysfunction of the brain is ultimately caused by a failure of the liver to effectively filter out our blood. A normal liver will filter harmful chemicals and toxins which are ingested into our blood through day-to-day activity. It ultimately prevents the buildup of a chemical called ammonia. A damaged liver, however, either from acute damage, such as a drug overdose or traumatic injury, or chronic damage, such as alcohol abuse or cancers, will not be able to effectively filter out these chemicals and harmful substances. This damaged liver will no longer be able to filter ammonia, and the ammonia will therefore build up in the bloodstream. Once the ammonia begins to build up in the blood, it will travel to the brain, where it will accumulate and build up there. After enough ammonia has built up in the brain, it will begin to have effects. We find these effects in the difficulty of the brain to both send and receive certain neurotransmissions which pertain to the body's movement and the function of the brain. Once ammonia has reached a critical point, which varies from patient to patient, patients will begin to display certain symptoms of HE. The most common symptom of HE is altered mental status, which is a blanket term to describe a variety of issues. These may include confusion, irritability, issues with attention span, and memory loss. Additionally, patients may suffer from other symptoms, such as difficulty with fine motor skills, difficulty with complex thought, such as reading, writing, and math, and balance issues. Treatments available for these patients include transplant, a variety of prescription medications, and various blood therapies. Transplants can be difficult because it is uncommon to find a matching donor. There is a risk of infection or rejection and other risks associated with surgery. Medications are often not 100% effective. They serve as reactive, not proactive measures, and they can be expensive without insurance. Dialysis, again, is not 100% effective, and donations only help for a short period of time. Ultimately, hepatic encephalopathy is uncurable. HE affects a variety of patients. Both men and women are affected in equal proportions. Patients who abuse alcohol for long periods of time are likely to experience HE at some point in their life, and individuals with chronic liver conditions, such as cirrhosis, are prone to HE. Cirrhosis counts for about 70% of HE cases. It is estimated that in the United States, approximately 300,000 people will be diagnosed with hepatic encephalopathy each year. However, this number can be slightly skewed. The reason for this is that many patients who experience hepatic encephalopathy go undiagnosed due to either lack of obvious symptoms or pre-existing altered mental status, making it difficult to discover the HE.